As you start posting stories of limits and loss, grieving, caregiving, it might be helpful to review from Doreen's text the particularly chapter 6 narrative themes of loss, violence, and coping, and some of the related topics. I think that as our agenda unfolds, some of the material that she presents will become more and more meaningful and also helpful. I don't want to reproduce or repeat the main points that Carrie Doreen presents. Rather, I will supplement with a tool that I have found to be very, very helpful, and is a pattern to visualize the process of crisis and trauma and the way to recovery. It's a very simple diagram that, believe it or not, is inspired in the work of Walter Brueggemann and his study of the Psalms. So I have it here on the board, and I will go over it rather quickly because, like I said, it's rather simple. In our lives, we have relative orientation or stability until something happens. We call it critical or traumatic events. Traumatic simply connote greater violence and pain. All traumatic events are critical, but not all critical events are traumatic, therefore. So, the critical traumatic event may trigger the crisis or trauma. So, friends, the event as such, the situation, for example, a death in the family may be a critical event, but it doesn't necessarily trigger a crisis. A crisis or a trauma, depending on the degree of pain and suffering and the violence that one is affected by it. So the response when there is a crisis then is disorientation that has meaning and affective and behavioral dimensions to it. The process of healing involves mourning and grief. Grief is the internal process. Mourning is what we might say the manifestations of the grief that are more visible to surrounding people. That's a common difference between grieving and mourning, by the way. So the way then towards reorientation, what we might call, or what is often called a new normal. For example, a widower that learns to cope with the death of a spouse and actually learns to live as a widower. And I added another concept that is the concept of prevention that correlates perfectly with this design. Primary prevention is like vaccinations. Before an illness happens, before, in this case, an accidental crisis takes place, there are efforts to strengthen our resources, for example, in the family, in the congregation. Yesterday, in our congregation, the program to become an even safer church, for example, I think that's a good example, very current, was unveiled. What are some of the procedures, attitudes, program in place in order to avoid critical or maybe even traumatic events relating with safety, of different kinds of safety. See? So then secondary prevention is attention as soon as possible to the emergence of a crisis. That is, when the response is a crisis or a trauma. See, the first responders, for example, is a language we use in hospitals and in police quarters, etc., means a prompt, quick, timely, opportune attention to minimize the possible damage, to offer support, nurture, whatever is needed, to make decisions quickly, and so on and so forth. And then tertiary prevention, as I said, is helping people go beyond coping towards a new normal and orientation. Very good. So you will receive a case study. In fact, it's already I posted it Moodle for Pastor Dawn, rather, caring for Jane. And it comes, this case study actually, we processed that at a colloquy with focusing on pastoral care and counseling situations with pastors and chaplains, and we met here and had a ball discussing cases. And I have permission from Pastor Dawn. You are invited to respond to that, and there are some guidelines. You will see that in Google. But I want to highlight 4 or 5 points in this case study, which is basically accompaniment on the road to a new normal. See? Tertiary prevention, in other words, just to combine the two concepts. First of all, it's wonderful how Dawn and Jane connect. And there is a gender dynamics, frankly, that is generated between these two women, in this case, that facilitates rapport. There is what is called in psychology an intersubjective kind of communication, subconscious. And Dawn represents a healthy person as a caregiver, a whole human being, available and accessible. Second, Dawn waits until the right time to approach Jane, to draw near. Dawn was alert until the opportunity presented itself. I like to say she welcomed the intuition, her own intuition, that the time was right. Why? Because she was alert, she noticed. Third, Jane was experiencing brokenness. Friends, there is a difference between woundedness and brokenness. We are all wounded. We have been wounded in one or more than one way. Brokenness is when either because of illness of one kind or another, or tragedy, or moral failure, makes it almost impossible for us to function. And by the way, in one of the early posting, there was this question about whether one's having experienced trauma was problematic when caring for somebody who had been traumatized also. The response, to put it in simple terms, is this: don't do it if you still have healing to do. You will remain wounded, but that woundedness may be actually become an asset for you to be a good caregiver. But brokenness is something else. You have the duty, the obligation to heal, to be healed before you care for others. So she had, Jane now, a severe emotional mental distress, and of course that affected, as always, her spirituality. There was a lot of hopelessness, despair in Jane's life. ECT stands for electroconvulsive therapy. Together with other therapies, eventually this was tried, electroconvulsive therapy, as kind of a psychiatric procedure that was effective in her case eventually, together with the other forms of care that she received. Another point I want to highlight is that Dawn never related to Jane as hopeless, even though Jane felt hopeless. So Dawn, as a caregiver, was an agent of hope. Jane could not receive hope from Dawn. Dawn could give Jane love, therapeutic love. Friends, love is the only thing and the best thing that we can give. Therapeutic love, sacrificial love, being there, accompanying, understanding, beholding, witnessing, validating. That can elicit hope in the other, but we don't give hope. See, we have hope, but especially we offer love. That is a distinction, and that is the utmost importance. That's the reason why love is the greatest. That's the reason why love, God is love. God is not hope or something less. God is love. Love is the greatest. Love is the great commandment. Dawn accompanied Jane as a parakletos, as the one who walks beside, like the Holy Spirit. You will read rather, and ponder how Dawn, could have accompanied Jane, even staying silent for half an hour together. And still being able to communicate precisely with the silence, in silence, that therapeutic love. One is reminded of the friends of Job. They remember the story, the novel Job in the Bible. The three friends were silent for 7 days, and that was exactly what they needed to do. But then they couldn't take it any longer and started psychologizing and moralizing, and that was the end of the kind of care that Job actually needed. So timing is of the utmost importance. Remaining as a witness, caregiving, and particularly in counseling, one is a witness. A witness validating the unfolding drama of the other's life, beholding the drama and the mystery of evil and grace. I hope you will read this case and take advantage of the opportunity to analyze it in your own terms. I just highlighted a few things. You have some other some questions that may possibly will point in other directions there, and it will be wonderful to learn together, to continue learn together from this case. So I look forward to reading that, and thank you for your attention to this guidance.